This decontamination program implementation course is designed to help you understand how to plan, create, and sustain a decontamination program. It is divided into 10 individual steps that will help to systemize your program development. These steps begin with a consideration of philosophy and end with ways to help train your decontamination team and sustain your program over time. Step 1. Obtain commitment to the program. Step 1 is more of a consideration of the philosophy behind establishing, executing, and sustaining an emergency decontamination capability, rather than a task to be completed. The primary goals of this program should be staff safety and quality patient care. An effective decontamination program requires a facility-wide obligation that has several facets of commitment. The first level of commitment is the willingness of your hospital's administration to devote required resources, including budget, space, staff time, and authority to the program. The results of your hazard vulnerability analysis can provide the necessary incentive if it shows your area is at risk for a hazardous materials event. Many departments are responsible for the success of this program. These may include, but are not limited to, the emergency department, security, maintenance, environmental services, and safety. Any single department cannot implement this program in your facility. Individuals from many different departments may be asked to do very specific and sometimes difficult tasks. A reward or incentive program should be considered for all participants. Policy development is the first process in gaining commitment and buy-in from all participants. In a later step, you will learn about developing an emergency decontamination response plan that details your facility's response to incidents involving contaminated victims. To ensure that your facility is dedicated to the program, this plan must be part of official policy and annual emergency management readiness activities. The Emergency Decontamination Response Plan should be incorporated into the hospital's Emergency Operations Plan, preferably as an annex, and address the various mitigation, preparedness, response, and recovery activities specific to hazardous materials incidents and emergency decontamination operations. To include the general hospital staff, they must be made aware that this program and plan exist. Training in the various facets of the program must take place. This can be part of emergency management training, hazard communication instruction, employee orientation, or other specialized instruction. At a minimum, those people who are most likely to have any involvement in the emergency decontamination operation must be aware of the program and understand what actions are to be taken. Members of the decontamination team require ongoing training and practice. There are a variety of programmatic and operational roles that your employees will be asked to assume in an emergency decontamination operation. While the titles within the Decon team don't change, the people who fill these roles may be based on availability. To be effective, each of those employees must be granted the authority to perform their role. It is quite likely that the emergency decontamination hierarchy will overrule typical lines of authority due to the specialized knowledge, training, and skill set required. For instance, a maintenance mechanic may refuse an ED director entry into the Decon corridor during an emergency decontamination operation if that mechanic is serving as the Decon unit leader. There should be absolutely no chance or implication of repercussion to the mechanic in this situation. This enables team members to perform the responsibilities of their roles during an emergency decontamination operation effectively and confidently, resulting in the best possible outcomes for patients and hospital staff. Step 2. Perform hazard vulnerability analysis. Defining the likelihood that a hazardous materials incident will occur at your facility or in your community is a key step in understanding the level of preparedness and response that will be required. General hazard vulnerability analysis is standard emergency management practice and required by all hospital accreditation organizations and other oversight regulatory agencies. These analyses typically include a consideration of businesses in the area, history of hazardous material releases, and the presence of high-profile venues. The presence of chemical processing and storage facilities, manufacturers, major highways or railroads, agricultural operations, military facilities, extremely hazardous substances, and companies that use chemicals in their daily operation must all be considered. According to EPA regulations, all facilities storing or using a threshold amount of hazardous substances must inform the local community of the substances present. This information is attainable from your local emergency planning committee. Many hospitals are designated as receiving facilities for emergencies that occur at chemical sites. It is likely that any large hazardous substance user or hazardous waste generator in your community has sent your facility a copy of their emergency or contingency plans and possibly the safety data sheets for chemicals stored or used on site. Check with your environmental or safety compliance representatives to determine if any of these plans are on file. You can also determine what type of hazardous substance releases have been reported in your area by checking the National Response Center's release database. You must also consider the scale of these events. If a spill occurs on a rural highway far from any population centers, you may have 1 or 2 possible patients to manage. If it occurs in a densely populated area, you may have dozens or more. The likelihood of catastrophes involving mass casualties must be fully considered. After defining the types of hazards, you need to determine the likelihood of a chemical release. This assessment is subjective, but by considering the presence of high-risk facilities, transportation patterns, and volume of chemicals available, you will get a good idea of the risk of the hazards. Only after fully understanding the types and likelihood of these events will you be able to completely prepare for them. Step 3. Determine response objectives. When a hazardous materials incident occurs in a community, a number of issues must be addressed. The released chemical needs to be identified and contained, people in the immediate release area need to be evacuated, and triage decisions regarding on-scene decontamination and hospital transport must be made. Similar thinking needs to occur at the hospital in order to properly align planning, training, and equipment acquisition with the decontamination response objectives. In the planning stages, appropriate personal protective equipment should be selected which provides protection against known materials in the community, decon procedures developed, equipment acquired, hospital personnel trained, and cleanup and waste disposal procedures implemented. There are several questions your hospital should consider to help provide them direction in determining the scope and capability of their emergency decontamination program. Will your hospital manage all decontamination activities, or will it require external support? Will the hospital's decon team be comprised of staff on shift, or will personnel be called in? Will the decon team be able to provide patient decontamination, guided self-care, and/or clothing removal only? Will decontamination capability be available 24/7? Will the team's responsibilities also include in-hospital chemical spills? Most hospitals focus primarily on the care of contaminated patients who arrive at the hospital by EMS or private vehicle. In most cases, this will involve fewer than 5 patients who are able to decontaminate themselves when given appropriate direction. Step 4. Develop and implement an emergency decontamination response plan. The purpose of the emergency decontamination response plan is to describe the process of how your hospital will provide and maintain a safe and supportive environment for their patients, visitors, and staff. This plan should address each facet of an emergency decontamination operation and should be incorporated into the hospital's emergency operations plan. According to OSHA, protecting healthcare workers who respond to emergencies involving hazardous substances is critical. Healthcare workers dealing with emergencies may be exposed to chemical, biological, physical, or radioactive hazards. Hospitals providing emergency response services must be prepared to carry out their missions without jeopardizing the safety and health of their own workers. Of special concern are the situations where contaminated patients arrive at the hospital for triage or definitive treatment following a major incident. Ideally, employers within the community will have coordinated emergency response planning with the hospital prior to any emergency event. However, the hospital may need to treat contaminated victims of emergency incidents without the benefit of such planning. These and other scenarios need to be addressed in the hospital's emergency decontamination response plan, along with plans for responding to a hazardous substance incident that occurs within their hospital. The hospital should prepare an emergency decontamination response plan even if community coordination has not been initiated or completed. The hospital's plan must be prepared in writing and established prior to an actual emergency. All employees and affiliated personnel expected to be involved in an emergency response, including physicians and nurses, as well as maintenance workers and other ancillary staff, should be familiar with the details of the plan. The plan should also include standard operating guidelines, which details the specific tasks and procedures required of each Decon team member, and job action sheets that describe the role and responsibilities of each team member. These documents will become the foundation of your training and exercises and will be relied on heavily during an actual event. Step 5. Decide where decontamination is to be conducted. Hospital decontamination should be performed at a pre-designated location. Entry and exit points should be clearly marked with separate flow patterns established for patients and personnel in order to limit the spread of contamination. The hospital decontamination zone should ideally be located outside the facility near the emergency department entrance, but away from the normal patient traffic flow of the hospital. An outdoor location helps dissipate vapors, reduces the level of respiratory protection required, and provides expandability to care for more patients, especially in a mass casualty incident. It should be located within easy access of decontamination and personal protective equipment and supplies, a source of warm water, and electricity. Engineering controls to maximize patient privacy should be considered. This may be best accomplished by utilizing an ambulance bay for decontamination or a portable shelter that can be set up quickly. A backup treatment site away from the emergency department should also be identified in the case of a mass casualty incident. If a permanent shower facility is used, it should ideally have a separate entrance from the outside, an independent ventilation system that exhausts to the outside, and a system to contain water runoff, such as a holding tank. The room should be large enough to manage at least 2 patients along with 2 Decon team members. A fixed facility, because of size limitations, inherently restricts the number of patients that can be treated simultaneously. For all decontamination processes, the patient traffic flow should be designed to keep contaminants as far from the emergency department as possible. Many hospitals need to consider designating both a protected and unprotected location for decontamination. For example, hospitals located in cold climates may require a Plan A outdoor and Plan B indoor location to shield against inclement weather. Hospitals with only an indoor decontamination room should also have outside decon capability in the event of a hazardous materials incident producing more than 5 or 10 victims. Step 6. Select necessary decon equipment. Once the hospital decontamination zone has been identified, decontamination equipment and accessories need to be acquired. The type and quantity of equipment depends upon the location where decontamination will be performed, outdoor versus indoor, weather, and the level of preparedness desired by the hospital. At a minimum, all hospitals should be prepared to receive, decontaminate, and treat at least 2 patients simultaneously. This is a typical number of victims seen in a hazardous materials incident that produces injuries. Some hospitals may desire to prepare for mass casualties, either because of the surrounding population density, perceived risks of large-scale chemical releases, or because of information obtained from their hazard vulnerability analysis. Decontamination equipment comes in various sizes, shapes, and price ranges. Each offers various advantages and disadvantages. The selection process typically focuses on two types of decontamination systems: portable, typically used when decontaminating patients outdoors in an ambulance bay or in a portable tent, and permanent decontamination equipment, which is used inside the hospital, typically in a room located near the ambulance bay. Step 7. Decide level and type of personal protection equipment. Personnel designated to perform decontamination must be equipped with personal protective equipment, or PPE, that is appropriate for the hazardous substances they expect to encounter. In most cases, its identity will be initially unknown. Factors to be considered in the selection of PPE include routes of exposure, degree of contact, and the specific task assigned to the user. The primary routes of exposure are inhalation, ingestion, and direct contact. Wearing PPE without proper training can be extremely dangerous and potentially fatal. Persons should not be assigned to tasks requiring the use of respirators unless it has been determined that they are physically fit to perform the work while wearing the equipment. A physician or other healthcare professional must determine what health and physical conditions are pertinent. Step 8. Determine training capability. First receivers require initial and annual refresher training that focuses on the individual's role and functions during an emergency decontamination operation, the zones in which they work, and the likelihood that they will encounter contaminated patients. According to OSHA, medical personnel who will decontaminate victims must be trained to the first responder operations level with emphasis on the use of PPE and decontamination procedures. The employer must certify that personnel are trained to safely perform their job duties and responsibilities. This includes a minimum of 8 hours of training or demonstrated competencies and an annual refresher. Hospitals may develop or contract an operations-level course focusing on decontamination and PPE use and measures to prevent the spread of contamination to other portions of the hospital, or provide additional training in decontamination and PPE after sending personnel to a standard first responder operations level course. The first part of developing a training program should be to determine how much of the training you can do yourself and how much outside contractors will perform. Training should involve a variety of formats including lecture, hands-on skill instruction, tabletop exercises, case studies, and live drills. All skill training should be done live with extensive hands-on practice. If your hospital has an experienced instructor, then this e-learning program should be used to supplement their efforts. If your hospital does not have such an instructor, then outside training resources could provide the initial training, and this e-learning program would be used to supplement the information. Step 9. Select Decon team members. Members of your Decon team need to be selected. Depending on the size and availability of your staff, especially during non-weekday hours, these individuals may come from areas outside of the emergency department. Areas to consider include security, maintenance, engineering, housekeeping, and EMS. Each of these individuals will need training. Some will require personal protective equipment, a medical screening evaluation, and testing. Enough personnel should be selected and trained to create a Decon team with members present in-house 24/7. Step 10. Train, drill, and sustain. Sustainment is a multifaceted process that needs to be ongoing and cost-efficient. The most important place to start is by ensuring the safety, health, and continued training of your current team members. Each individual who will wear protective clothing and a respirator will need a medical evaluation and should have close follow-up on any exposures or reported problems. It is also important to hold regular meetings with Decon team members for quality control purposes, team building, and communications, as well as for short in-service training sessions. Ongoing instruction can be broken up into manageable segments. A different skill set and procedural task should be practiced during each session in order to keep your Decon team prepared and confident. For example, 1 month should be devoted to setting up the Decon corridor. Another month should be designated for donning and doffing personal protective equipment. Investing a few hours per quarter will ensure continued familiarity. Don't forget about those staff members who work evenings, nights, and weekends. Now is the time to actually do your initial training. Based on your findings in Step 8, this may involve the scheduling of outside resources or development of training programs in-house. At a minimum, operations-level training must be conducted for any employees who will respond to contaminated patients. This initial training must include practical exercises with Decon equipment and PPE. It is very advantageous to hold a few tabletop drills during the initial training to familiarize the team with the flow of the process. A live exercise should follow the tabletop drills so that each Decon team member will have a feel for different roles that they are training for and may fill during actual incidents. Drills and practices should follow on a regular basis. Your Decon team should also review the various informational topics and skill training included in this e-learning program at least quarterly. Each of these courses is very task-specific and time-sensitive and can be accomplished through self-study or in a group training environment. This simple process of ongoing training helps keep response skills current and reduces the need for structured annual retraining. Remember to document all training encounters. Since the employer is responsible for certification, proper documentation becomes essential. At least once a year, each member of your Decon team should demonstrate their knowledge, skills, and abilities through exercises and drills. Each of these training sessions should be documented for each member of your team. It may prove beneficial to utilize trainers or outside experts to observe your exercises and drills in order to audit your program. Review plans, policies, procedures at least yearly or after an exercise or incident. Begin recruiting additional team members to ensure that all shifts have trained personnel. Cross-training of these individuals helps confirm that all necessary Decon team positions will be filled during an emergency decontamination operation. Sustainment also requires your hospital to keep up with regulations and related current events. Topics related to hospital hazmat preparedness are provided by DQE in their email bulletins and quarterly newsletters. To continue receiving this information, you need to make sure the email addresses of your Decon program coordinator and team members are current with DQE. Finally, it is very important to instill enthusiasm and pride into your hospital's decontamination program. Give thanks and special recognition to your Decon team members through incentives, posters, identifying pins or badges, and support their continuing training efforts. It is also beneficial to your hospital to get them involved in community response planning and exercises. On the equipment side, you should continually maintain your gear through proper cleaning, inspecting, repairing, replacing, storing, and securing all items. Over time, your equipment and supplies will need to be updated and expanded. This course was designed to help you develop and sustain a decontamination program. You should understand that there are several key steps to this process. Each step should be reviewed carefully for applicability to your hospital's emergency decontamination response plan. You should also be aware that once a program has been developed and implemented, Often the hardest part is sustaining it. Success can be enhanced by dividing the annual instructional requirements into monthly or quarterly training programs that can be conveniently accomplished before, during, or after one shift. Hopefully the ideas presented here will help you maintain your program so that your level of preparedness is always ready now for what's next.